and we're just like, can we now please talk about the C word? In this case, the good one, the cure word, and should we stop therapy? And it's happened with CLL. That's totally changed after we were able to highlight what we can attack and
Yeah.
things like that. So it's basically, I think what we're saying is cancer is complicated.
Yeah. I mean, I studied CLL for a long time too. That's actually how I got into cancer research. The
Oh,
first lab that I got into, we studied mostly like from a biochemical perspective. So I'm kind of immunology trained, but it was kind of as an excuse to be a biochemist. We studied all the signaling events that happen in CLL, and this is actually how I got into the endoplasmic reticulum stress response, or the ER
huh.
stress response, because as B cells differentiate from naive B cells into plasma B cells, they very dramatically increase the surface area of the endoplasmic reticulum to increase the overall production of antibodies that they can make. And so, one characteristic of CLL is, or chronic lymphocytic leukemia, is that these patients will often develop kind of defective B cells, and they'll only produce one type of antibody, and this is called monoclonal gammopathy of undetermined significance, MGUS.
Yes.
You might have even heard that too, and it always rattles my brain. But basically, they need to utilize the ER stress response to upregulate specific enzymes to increase the surface area, enzymes and transcription factors to increase the gene signature of to increase the surface area of the ER to account for that increased immunoglobulin load or antibody load. And so when we target the ER stress response in these leukemia patients, you're essentially affecting the ability of how those CLL cells differentiate into plasma B cells to kind of be, exert their screwed up cancery thing on the body. So one characteristic of CLL is a very swollen spleen or splenomegaly. So the way that we assessed whether or not our therapy was working was if it reduced splenic burden. In actual patients, the spleen will enlarge and ridiculous. But obviously, we did this in mouse models, and you have a tiny spleen in a mouse, but it went like this. Now, if you were to scale that up to what happens in a human being, it's insane. So that's one reason why I think I went off on a tandem there. But kind of extrapolate a little bit on how just diverse different cancers can be, and how various cells will utilize different mechanisms, although the same, between different cancers to support this particular one specific phenotype, which we can target in multiple contexts.
No, I love it. And that's, it brings an important point that I haven't been able to say on a podcast yet, but I tell my patients all the time. When you have monoclonal stuff, so whether it's MGUS or monoclonal gammopathy of unknown significance, or, and a lot of people don't test for this enough, but it's called monoclonal B cell lymphocytosis.
Hmm.
So it's not CLL, but it's usually got a clone of B cells and not enough of them.
Right.
MGUS or that. You can get in that exactly what you said, aberrant or screwed up B cell, like, oh, you have different kind of antibody. You can get things that are antibody mediated, like inflammatory bowel disease, lupus, ITP, vitiligo, anything that you would see a rheumatologist for, or autoimmune disease, can actually be basically a spin-off or secondary to having a clonal process, which is why I keep teaching it in all my lectures and residents and all fellows. Still haven't seen one in practice myself. I got, excited about a vitiligo with CLL. I'm like, maybe it'll get better. And she's like, no, I had it since I was 9. And obviously she probably didn't have CLL because I was diagnosed at 45.
Hmm.
But there's something to be said about people that usually have this MGUS or CLL and have some other kind of, again, lupus, autoimmune stuff. And when you can just attack those B cells, like hard, like with the high dose steroids, pulse it or do it weekly, and then you give them something like rituximab. That's why we use rituximab in rheumatology as well.